Hey, Adjust Teen Stress. I'm Avashesta, and welcome back to our Beyond the Brain series, where we interview health professionals and experts about mental health in order to get a deeper insight of different aspects of stress and mental well-being. Today, I'm here with pediatrician Dr. Maria. Dr. Maria, can you please start off by telling us a little bit about yourself and your background?
Yes, thank you so much. It's an honor to be here. I am a pediatrician and I finished my training in pediatrics in 2012, so 12 years ago. And then I specialized in child advocacy and community pediatrics. But while doing that specialty, and after I finished it, I focused my practice on specifically teen mental health. Right now, I am practice leader at LVHN in Pennsylvania in the division of adolescent health, and I see, patients every week at the clinic, and I mostly address mental health concerns.
All right, and what made you choose this career field of pediatrics?
Well, I've always had a passion for working with children. I believe that children are in their, kind of like most natural state, innocent, just still cheerful about life, and they are able to really kind of change things or modify things for their health. And also if they're sick, usually it's something that we can help them with, and we can really improve their quality of life and their future, which is like an investment in our world and our communities. So that's how I chose pediatrics.
And then, as you specialize in the realm of teen mental health, what do you think are the most significant trends that you've observed regarding teen mental health over the past couple of years?
Well, the most terrifying and concerning trend is a trend of like loneliness with the increase in social media. And after pandemic, there really has been an increase in teens getting isolated because they feel that they're connecting through social media with things and someone's, but they're isolating themselves at the same time from the real world. And that ends up being kind of like a loneliness epidemic, which can lead to symptoms of depression, anxiety. Um, there's some PTSD that's happening a lot with teens when they have been exposed to traumatic experiences or um, severe isolation or neglect during pandemic years. And there's also a lot of body image issues that are happening because of this exposure to all of the online world, which is very new and uncontrolled.
So, you're talking about some of the impacts that social media has on teenagers' mental health these days. What do you think are some strategies that families can do in order to mitigate these negative effects that social media has?
Yes, absolutely. That's a really hard and important question. So, every day we're trying to find out new ways that we can guide parents because this is such a new world. I would say the first thing is just one simple thing that we're trying to promote now is to delay it as much as possible because it is something new and it is even new for us. So when something is new, like the car, there was not any safe regards in place, and there was accidents in the car, and then you didn't have a seatbelt. And then we found out that, when you are in a car without a seatbelt, you can die. But if you have a seatbelt, your life can be saved and it's much safer. So then the rule came in place. So I think as the brain develops and as the child is growing, they're more vulnerable to the effects of what they see. So the one thing I would say that can be the most life-saving would be to delay the access to social media and to a cell phone as much as possible. So, the age keeps getting younger because there's so much access and we want to locate our kids and know where they are. But if we can replace the phone access to something else, like an Apple Watch or some other device that can locate our child, if it's for safety, we can delay the access to social media and other platforms. So we're trying to delay this until like the late teen years, like 15, 16. That's the recommendation at this time, to try to delay as much as possible, decrease the time that they're in it once they have access. Have a lot of conversations around it, talk about it every day. What are you seeing? What are you exposed to? Try to watch it together at the beginning. Like if the kids are starting to do iPads and stuff like that, do it together so you can have that conversation. And then once they have access, stay attentive and have access to their account so we can see what they're accessing and we can guide them appropriately. So that would be the recommendation in it says stay very involved and put a lot of boundaries. So we don't have to do what they ask. They're always going to ask for it, and since they're 10, they're going to ask for it.
And then we're talking about mental health, which is a very broad thing. So how would you explain mental health in 3 words and why?
Mental health in 3 words. Well, the one thing I would say is disease. It is a disease. The second word would be environment. It is a disease that is affected by the environment. And the third is would be early. So it would be like it is some people have a misconception that it's something that people can just shake off and recover from, and that they need to do better and then just go pray or go do exercise or do something about it, just be happy. Well, no, it's a disease. When it's a disease, you need to seek treatment and seek help. That's the one. The two is environment does affect it. I mean, if a child has been bullied, if a child has been had trauma, if the child has gone through stress in the family or a death in the family or separation or traumatic divorce or violence in the family, that's going to affect it. So it cannot be separate, but it's not necessarily a cause. It can basically trigger something that was underlying. And third, it's early. The earlier we start treating it and the earlier we diagnose it or we know what's going on, the better the outcome and we can treat it. Even with things with ADHD, well, they have it. What is it going to be a difference for us to know or not to know? Well, if you know that a child has ADHD, you can provide them the services in school for them to thrive, for them to do better. And then also the therapies that they need, the support and the skills, the patience that they need. And then if they need medication, that can be an option. But if you don't know what your child is struggling with, you can't help them.
So there's a lot of talk about the whole physical health and mental health are the same thing. Some people think that one's more important than the other. What is your thought process behind that?
Well, I believe in the mind and body connection. I believe it's not one thing or two things, it's just connected. So, whatever the body affects the mind and the mind affects the body. And sometimes we can do it in amazing ways. Like if we have a mental health issue or a trauma issue that we're not dealing with, it will manifest in the body. We just want to bottle it in. We don't want to talk about it. It will come out in the body. And I've seen severe cases of that. Like I've seen a teen with seizures that, was having them every day, 3 times a day. And they were real seizures, but they were not caused by epilepsy in the brain. It was caused by a psychogenic response of the body. So that's how severe it can be, the body's response, or it can be as simple as a belly ache or a headache. So I feel like they are connected and they need to be addressed as a whole. So as an adolescent doctor, I see patients and I see their whole body, their whole system, and their mental health. And then we talk about what symptoms could be related, what symptoms are separate.
Okay. And then as a pediatrician yourself, do you think that is important in order to have a collaboration between pediatricians, psychologists, and schools in supporting children's mental health? And if so, can you discuss a little bit more about the importance of that?
Oh yeah, that's definitely crucial. We don't work in a silo and all of the environments are important. So we as mental health specialists, we're working with the parents and we're working with the school and I always most of my cases, 90% of my patients are also seeing a therapist if they're seeing me. And we have to collaborate because we can find out and help the patient much more if we are talking in the background about what's best for this patient because we're both seeing different perspectives and we're both taking care of different parts of it. And then we're collaborating. So I believe in the multidisciplinary approach and the team approach for patient's health.
And then earlier you talked a little bit about how families can help with the whole social media affecting the teens' mental health. So with that being said, what are some other things that you think that parents can do in order to help that mental health care process for their children?
Well, I think would be education, explain to the kids that everybody gets affected by mental health, like even us as adults, and we can model that. So we can model restricting ourselves from social media and saying, oh yeah, this phone plays tricks on me, like this phone is addictive, even for me, and then setting a time to be away from screens, and then the whole family does it. So it's not like you have to stay away from screens, like we all gonna do it. That's one. And two would be communicating about the feelings. Like when I look at social media, I feel sad when I compare myself to maybe other moms that have it all together. or they are like, in shape and fitness, and I'm seeing myself, I'm not that way. When I compare myself, I feel a certain way. How do you feel when you compare yourself? So trying to open up about feelings and how something makes us feel. Sometimes if they don't know how they're feeling, that can come out in different ways that are not healthy, and they don't know that they can talk to someone about it or that it ever happened to their parents. So I would say modeling healthy behaviors around social media and phones, and then communicating a lot about feelings around social media and phones.
And then, as a pediatrician and a mother, and as you're an individual in adulthood, can you share your perspective on what you think today's current state of teen mental health is and stress is like compared to how you were a teenager? How is it similar or different?
Well, I think based on statistics, it's worsening. And I think it's more about those social connections that are so important to our lives. Like I have some kids that they tell me they have no friends and they have nobody to talk to. And that's so important. Like we didn't have those outlets in technology, so we would seek out to go out in the neighborhood and play with our friends and have that connection. So there was a lot of depression, anxiety back then too, but there was like the buffer. And right now we're missing that buffer. So it's like going back to the roots and being outside in nature and being with friends that we need to kind of like improve at this time. But there is a mental health crisis right now. So definitely it's worse. And by many factors that I mentioned before.
Yeah, I 100% agree. And why do you think that is important for adults and teens to be educated on the topic of just general mental health and stress?
It is important because there's a lot of stigma around it. And if you're not educated or you don't know how it can present or how to address it, you can delay the process and really try like ignore things. And then it can be very late when you're addressing it. And when it's late, it's harder. So it's always like I have parents that have seeked me out for health coaching, like kind of like they're having the beginning of difficulties with their children. And I think that's great because the preventive approach is always the best approach. So it's kind of like if we're reading all the time and we're learning, we can really kind of have an idea of what can happen and how to address it from the get-go, and we can help our kids faster.
Yeah, like doing these interviews, I've talked to like a bunch of different people in the mental health industry, and everybody has kind of told me a little bit of everyone has mental health. It's not something that you can avoid or anything. And so definitely learning about it since it's something that's attached to you, like mental health is mental health, whether it's good or bad. So kind of getting educated.
Yeah,
Yeah.
exactly.
I have one last question for you. So, what advice would you give to someone out there that's struggling with their mental health, or like some kind of message that you would like to leave to our Address Teen Stress audience?
Yes, I would say, try to make sure that you know your sources. Like a lot of people are just talking things out there, but if you're, checking on Instagram, check the source, like that it's a doctor, that it's somebody certified, that they have credentials. Two, seek out one person that you trust in real life that you can open up with and that you can share things and that they're vulnerable with you too. That is even more important than having like a therapist or a doctor. And three, I would say a lot of people try to think mental health psychiatry. Like I have to find psychiatrists and that's so complicated and so difficult. Well, no, your primary care doctor usually can help you start the process of helping if your mental health is in the negative or concerning. So seek out your doctor or your school counselor or someone that can really direct you to the right help and do it early. And don't be worried about opening up because you shouldn't feel shame around mental health. Everybody has mental health, as you said.
All right. Thank you so much, Dr. Maria, for talking to us a little bit about mental health and your experience with it throughout your professional career as a pediatrician, as well as thank you so much for helping us address teen stress.